Steve, you picked a wonderful guest. This is by far one of the best guests that we've ever had on this award-winning show.
Yes. Oh, thanks, Butch. I really appreciate that.
I was going to ask you, Steve, what made sense for the Chester Housing Authority to be involved in the way that it's involved here?
Well, sense or no sense, when KBM comes calling, you answer the phone. Look, the years ago, I got into the mode of how housing was related to health. That's, if you don't have adequate housing, well, then you're already, you're working at a disadvantage to tending to your health, because you're so consumed with, maybe where you're going to sleep tonight, or where you're going to get you and your family permanently to a safe and acceptable location. So everything else goes out the window, and the first thing to fail is going to be your health, because you're just not in a stable enough environment to really focus on it. The first encounter I had with Kristin Ball-Motley won me over right away. So she came to talk to a group of seniors about their prescriptions. And it's this whole health and education tie-in. We're all, we all get prescribed things. We don't even question it, think about it. We just swallow it down. And, here was somebody that was concerned with, are we over medicating ourselves, or are we wrongly medicating ourselves? How can the average person be expected to understand that? Just listen to what doctors and pharmacists tell us automatically, because we just automatically trust them. But, I think her thing was, doesn't hurt to know about a few things yourself going in. And she offers that service to people for them, because they don't all have her level of education. But so that was just a little introduction to her. And then that led to branched out into so many other deeper areas of health and education. But so if my primary goal is to get people housed so that they can tend to the other aspects of their life and improve their family situations, then naturally I'm going to be partnering with people who have more expertise in health than we do, so that we can bring that all together simultaneously.
What can people expect when they engage your organization?
So a few things that we try to focus on. One, we are addressing health inequities. We are eliminating health disparities, working towards the elimination of health disparities, and promoting health literacy. So through all the projects that we work on, they are pushing that mission. And we do that through a number of ways. One is we engage the community on health information, health topics. So we go out into the community. People always ask, where is your office? Where's your office? I am my office. Wherever I am, that is my office. And so people don't come to us to do anything. We are out in the community. We're at the sporting events like the basketball games or Chester Panthers, or we're at health fairs, community events, churches, schools, wherever the people are, we show up and we do what we do there. So a lot of community education and engagement. My outreach team is trained on trauma-informed care, effective communication, because we really try to bring a non-judgmental approach to what we're doing. We are not judging anyone for their decisions, because we know that it's based on something. We just ask that people be willing to hear an alternative version of the truth. Just be willing to listen. We don't have to agree with each other, but just take this perspective and we'll take your perspective, and you do what you do with the information. But one thing that I want to say is, I don't want people to say that they did not know. Do not say that you did not know. When you have engaged with us, At least be willing to listen. You don't have to agree, but don't say nobody didn't tell you, because we told you. So that's one thing that we do, is we go out into the community to educate and engage there. Another aspect of it is to train healthcare providers. When I was going through my diligence, my necessary diligence in not wanting to get the vaccine, and talking to my own primary doctor, primary care doctor, and to other health professions, they was just like, how could you be a pharmacist and not want to get vaccinated? Well, I got my vaccine, and why can't you get yours too? And blah, 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 blah. And I was like, these people do not have empathy. And I love my doctor, but he just hit me with the, I got vaccinated and I'm good. And I was like, okay, what that got to do with me? He's a white male. So I'm like that don't make me feel better because you got vaccinated. So what we try to do is we try to educate healthcare providers on empathy, on cultural competency, on implicit bias, and topics that will allow them to better engage marginalized communities, that understand their challenges, be more empathetic, and better address their health challenges.
Education is the key word here. You know, Butch, as you and I have been in a few conversations recently about, we've sort of tabbed the housing authority as the education housing authority. You know, it's one thing to house people, but while we have them along for a ride, it's also good for them to learn how to better be housed and stand up for themselves, because eventually they will move on to a more independent situation. And, you know your rights, you know, when you're dealing with a landlord. Understand the system when you're applying for a mortgage, so that you can stand up for yourself and ask the right questions. You know, when I think of Kristin and all her talking to people, I think of a scenario like this. So, person, perhaps of color, is sitting in a doctor's office that, unfortunately, just instinctively may not take them seriously. But they come armed with the right questions to ask, and that gets people's attention, and that makes them tight, and that makes the physician or the nurse or whoever you're dealing with at the time tighten their belt a little and maybe give you a little better attention. It's all about education. Education is power. That's the number one thing to seek, you know, to make sure you pick up, you know, as you're going through life, more than any other thing. Because as sometimes I've said, in life, you know, you're going to get screwed a lot of times. But if you're educated, at least you know you're getting screwed. And then you maybe can come up with a better plan on how to react to and deal with it.